This pictures describes about the direct technique of making a provisional restoration after the tooth preparation is done. So first is this shows a pre-operative picture. Next is a removable partial denture which is placed over that edentulous side. So after placing that, a putty impression is taken. So after removing that, the edentulous side from the putty impression. So the removable partial denture comes along with the putty impression. Next, after the tooth preparation is made, after the tooth preparation is made, the putty impression which has been made before pre-operatively is taken and the resin is mixed, which is resin. The provisional restoration is mixed with polymer and monomer and is poured into the index material. So this putty index is placed over the tooth surface which is prepared. So this putty index will provide a provisional restoration that is adapted to the tooth margins on the prepared tooth. So then the provisional restoration which is present inside the putty index is removed, trimmed, and it is polished and it is cemented over the prepared tooth surface. So this produces about the explains about the direct technique of provisional restoration fabrication. So next is an indirect technique. So in the indirect technique, the preoperative cast is made. In that cast, the missing pontic teeth is replaced and a splint is made over that. And after this, tooth preparation is made. So again, the definitive cast is made, which replicates the prepared tooth surface over which the splint which we have made from the preoperative cast is filled with the provisional restoration resin. Acrylic resin is mixed and placed in that, and after which this splint index is placed over the cast, which is post-operative, which means it is prepared to surface cast. That definitive cast is made to produce an indirect technique of producing provisional restoration. So next will be the combination of direct and indirect technique, in which first on the diagnostic cast of edentulous area are restored and wax correlation are done. Next the putty index is made, after which the tooth preparation is done manually over the cast, which is a preoperative cast, and the putty index is taken. So next will be the polymerizing resin. Acrylic resin is poured into the putty index, which is preoperative putty index, and it is placed over the cast, which is having the prepared tooth. So this prepared tooth is made manually on the diagnostic cast, after which the abutment teeth are prepared in the patient's mouth accordance to the which is prepared in the diagnostic cast. Then the acrylic resin is added to the retainer in the provisional restoration, and this restoration is stabilized into the patient's mouth. So the final restoration is final provisional restoration is we have obtained, which is cemented after polishing and finishing it and polishing it. We are cemented in the patient's mouth after the tooth preparation.